Which of the Kardashians has had plastic surgery? Who's had the most? Let's find out.
This one is pretty special. We've got Kim Kardashian. She's had a lot of successes in her life. She's really accomplished a lot, all these amazing things. And so here we are talking about what type of facial plastic surgery might she have had. So in 2007, Kim was 27 years old, and when I look at these photos, to me it looks like she had a rhinoplasty. The rhinoplasty was mainly to reduce the dorsal hump, which is that bump on the bridge of her nose, so we can see that reduced. Then we move on to 2008. She's now 28 years old, and this is where things start to really change for her, in that I think she's had cheek implants placed. These cheek implants are meant to volumize the under eye area and give more prominence to the mid-face. And it looks to me like she may have had a canthoplasty as well, where the lower lid of the eye is pulled out and up, and that helps to kind of create that more almond-shaped type of eye. So 2009, not much change here. 2010, now 30 years old. I think Kim Kardashian has had maybe a fat transfer at this point. The face looks a bit fuller, and that is just a guess on what she may have had. Now, Botox filler, I think she's getting maintenance treatments from fairly early age and continues to do that. 2011, age 31, I don't really see any major changes in Kim's face. 2012, same thing, not much has changed. 2013, Kim is now 33 years old. She did have her first baby around this time, so I know the face might look a bit fuller from that pregnancy. But what I'm seeing aside from that is that there are some signs of a revision rhinoplasty, and I'm not sure when exactly that was done, before the pregnancy, after, when she had the kid, I'm not sure. But either way, it seems to me like the hump that was initially sort of shaved down, but there was still some sign of a dorsal hump, now it's completely gone. The tip of the nose to me looks more lifted, and the philtrum, which is this portion here between the nose and the upper lip, to me looks longer. It looks like it's longer, maybe because of the aging process. As most of you know, as we get older, skin stretches out, and it does that at the philtrum as well. So that's possible. Also, it's possible that from her prior rhinoplasties, the philtrum may have stretched. There are certain muscles here at the base of the nose during a rhinoplasty. Oftentimes they're severed, not as a problematic side effect of the surgery. It's just something that happens as part of any rhinoplasty, or most rhinoplasties. And so the philtrum can get longer from that, and that is something that I'm seeing here. So it could be age, it could be the prior rhinoplasties. 2014, age 34, I don't see any major changes. 2015, age 35. Let's take a look at Kim's hair. To me, it looks like I'm seeing a different pattern, and I know that she's admitted to doing some laser hair removal at the hairline for some fine hairs, but it seems to me like there's more than just laser hair removal. To me, it seems like the entire hairline is different. I think she went from a more kind of M-shaped type of hairline to something a bit more rounded and very feminine looking, and so that to me looks like a change from what came before. And it could be that there's makeup, that there's a hair piece type of system in place, or a wig, but I do think that there's a chance that she may have had a hair transplant around that time. 2016, she is now 36 years old. I don't see any major changes. 2017, age 37, the philtrum does look shorter. And so the question is, did Kim Kardashian have a lip lift, or could this be primarily makeup? And I know that Mario, her makeup artist for a long time, has this thing he calls the Mario's lip lift, and it's basically a way of lining the lips so that they look like they're more full, and then the philtrum then looks shorter. So
what's up, everyone? It's Dr. Gary here from the future. I wanted to comment on the Kardashians and their propensity for photoshopping their images of what you see online. I think it sets an artificial beauty standard that is very difficult to achieve. I don't think it's healthy for everyone else who's following them, who's clicking on their pictures, who's absorbing all of that data, and really can never achieve that same level of beauty because it's fake. And I wanted to point out that Kim does appear to have a subnasal scar from what looks like to have been a lip lift. The lip lift incision goes right at that junction between the nose and the upper lip. And as we can see in her recent Instagram picture, it does appear that she has this type of scar, and I've seen it now when I look back at other pictures as well. So that gives us some more evidence that she likely did have a lip lift to reduce the philtral distance. The philtral distance got longer after her rhinoplasties and with the aging process, and she went ahead and shortened it with a lip lift. That's what I can see.
2018, age 38, I don't see any major change. 2019, same thing, looks about the same. 2020, age 40, to me it looks like she may have had an upper blepharoplasty. I'm seeing less of the supratarsal crease of the upper eyelid and just a bit more of that kind of hollowing that you sometimes see after upper blepharoplasty when skin is removed. And so that's some of my thoughts on 2020. Also, it looks like she may have had an endoscopic type of facelift. Her face it's just very tight, almost unnaturally so, especially for 40 years old. And it's just a guess, I'm not sure. 2021, age 41, I don't see any further changes to her face. So let's do a summary of Kim Kardashian's facial plastic surgeries, at least according to what I think may have happened. First, we've got a rhinoplasty. I'll give you approximate price ranges, and I'm sure she's paying on the higher end of things. Rhinoplasty, $10,000 to $20,000. Revision rhinoplasty, $15,000 to $40,000. Cheek implants, $15,000 to $30,000. Botox and filler maintenance over the course of, say, about 13 years, about $10,000 a year. Fat transfer to the face, $10,000 to $20,000. Cantoplasty, $10,000 to $15,000. Revision cantoplasty, if that's something that she had, could run up to $15,000 to $20,000. Hair transplant, $15,000 to $25,000. Corner lip lift, again speculative, but $5,000 to $10,000. Endoscopic facelift can be anywhere from $30,000 to $80,000. Total amount for Kim Kardashian is approximately $390,000. Now, for most of us, that's way more than we can afford, but for Kim, that's a small fraction of her net worth and something that she could totally afford. And don't forget about potential body plastic surgeries that she may have had as well. I'm a facial plastic surgeon and a hair surgeon, so I'm not going to comment on the body work, but there are other videos out there speculating on potential body surgeries.
Has Khloe Kardashian had facial cosmetic procedures? In 2006, at the age of 22, I'm seeing nice brow hair fullness and infrabrow fullness. She has some alar base flaring with a bulbous tip. She has good cheek and chin prominence, and she has nice full lips. You can see that the upper red lip has slightly more fullness compared to the left. And as you guys all know, asymmetry is very common. In 2007, at the age of 23, I'm seeing a slightly depressed scar at the glabella, which actually reminds me of what we talked about with Shakira. Khloe's lips have a nice Cupid's bow definition, and she has a relatively short philtrum and slight lateral upper lip inversion on the sides up here. In 2008, at the age of 24, Khloe has a rounded hairline in proportion to the middle and the lower thirds of her face. She does appear to be right side dominant, and you can see it in the upper and lower jaw structure and the degree of muscle pull on that side when she smiles. You can see how it pulls more because she has stronger musculature on that right side. In 2009, at the age of 25, no changes. Same in 2010 and 2011. In 2012, at the age of 28, it looks like Khloe may have started getting lip fillers around this time and maybe some cheek filler as well. In 2013, at the age of 29, I'm seeing some signs of Botox to the common areas such as the forehead, the glabella, and the crow's feet. In 2014, at the age of 30, I don't see any obvious changes. In 2015, however, at the age of 31, I'm seeing some signs of potentially a cheek implant that was placed. You can notice the contour change on the lateral element of the cheek. That looks very regular and to me looks more like implant rather than filler. She also appears to have a smaller chin now compared to prior.
prior. So I wonder if maybe she had a chin reduction around this time. And when I look at the mid-cheek area, it looks a bit more hollowed compared to how she was originally. So potentially a buccal fat removal as well. And her brows to me just look more lifted. So I surmise that maybe she had a brow lift around this time as well. In 2016, at the age of 32, there are no further changes seen. In 2017, she was pregnant around this time. I'm not seeing any changes. And same in 2018 and 2019, no further changes. But in 2020, at the age of 36, I'm seeing several major changes in Khloe's face. For one, it looks like she had a rhinoplasty, and she actually admitted to having had a rhinoplasty around this time. I think that osteotomies were done on the bridge of the nose to narrow it. I think there were some tip refinements, and I think she also had an alaroplasty to bring in the wings of her nose. Overall, it looks like a very well-balanced nose, and I think that her surgeon did a great job. I also think that Khloe may have had V-line jaw reduction surgery. So prior, I mentioned that she likely had a reduction of her chin, but now it seems like the entire lower jaw just has more of a V shape to it. So I wanted to also point out here that when you look at the mandibular ligament area, it looks like it's been smoothed out. Now that can happen for one of two reasons, potentially both. Either she had a bony reduction, smoothing out that transition into her chin, right, into the mental process here, the chin, or she had a facelift where the face was tightened, and that may have released the mandibular ligament. But I think that more likely she had had an actual bony reduction of the lower jaw, because it looks like it's not just the skin changes that I'm seeing, but the entire bone just looks reduced compared to prior. In 2021, I'm not seeing any further changes. In 2022, at the age of 38, I think that Khloe may have had an upsize to her cheek implants. It looks like maybe they were replaced, and now the cheeks look a lot more prominent. The total cost of all these potential procedures is $275,000. I wanted to give you guys a reaction video here to really an analysis of Kylie Jenner and what work she may have had done on her face to get from where she was to where she is now. Obviously, she's a super successful woman. She's kind of set the tone for a lot of our beauty trends, and so I think it's useful to take a look at these images and really try to figure out what has changed. People want to know, they want to know what they can do to maybe look more like her, or just out of curiosity, like what did she do to get there? And so I'll share some thoughts with you, see what you guys think. So if you like the video, please make sure to like, comment, and subscribe to my channel. Starting with the forehead, I mean, she's young, right? So I don't think she's getting Botox necessarily yet, but she's got so many kind of resources and ability to get all this stuff. So she may be, right? But she doesn't necessarily have to be to get from where she was 5, 7, 10 years ago to where she is now. She's still young, so I don't think she's getting too many frown lines. But for all we know, maybe there's some Botox going on for the forehead, glabella, crow's feet to kind of continue to keep that youthfulness. Moving on down, I'm looking at her eyebrows. From when she was younger to where she is now, there's a lot more fullness there. And options for doing that are makeup, there's microblading, there's eyebrow hair transplant. I think in her case, it's probably a combination of microblading and some makeup that has given her eyebrow shape a lot more fullness, a bit more extension. It's coming up a lot closer to the center of her face compared to where it was before. And that really adds character and is kind of a more modern day trend in addition to all the lip stuff. But the eyebrows looking more full is definitely a more kind of attractive feature and something that's very in right now. And also the eyebrow shape, right? Because a lot of people like the fact that the lateral part of the brow, or the tail of the brow, appears to be more elevated in her, whereas it wasn't exactly like that when she was younger. And that can be achieved surprisingly well with makeup, so it could just be kind of a makeup trick that she has. The other thing that people are doing now to create that kind of fox side look is thread lifting on the lateral aspect, or in some cases a lateral brow lift. but that's a bit more involved and carries some risk of scarring. And so I don't think she necessarily had a lateral brow lift. Potentially there's some threads going on here to account for this new lifted tail of brow look, or maybe just some good makeup that can also create that. Not 100% on that, but something has changed. Now if you look at her nose, the nose had quite a bit of flatness to it. It had a wide upper and mid vault, we call it, or the upper and middle portion, as well as the tip just were kind of broad and poorly defined structures. Over time, the bridge of the nose appears to be more narrowed and the tips appears to be more defined. And so that is most likely, almost definitely, the result of a rhinoplasty that, in my opinion, was well done. It does balance her face nicely. It takes attention away from the nose, which is one of the main goals, actually, of a rhinoplasty, and brings it out more to her eyes and other features of her face. So that, I think, was done. If you look at the nasolabial folds, I think she may have had some filler along the folds just to soften them. There's a little bit less of a division between the cheek structure and the upper lip, and that is most likely because of some filling in the nasolabial folds. The upper part of the cheeks appear more full, and that again is likely the product of filler, and the jawbone structure seems a bit more squared off, a lot more squared off, I should say, the more I look at these photos compared to when she was much younger. And so that again is most likely due to the effect of filler to give her a bit more of a squareness, which is again kind of a modern day beauty concept. I find that a lot of my patients who start off with a more kind of narrowed jawline, they want it to be more square, and my patients with the more square jaw, they want a more narrow jaw. So we all kind of want what we don't have, which is human nature. And then to kind of get to the elephant in the room, of course, it's her lips, right? What did Kylie do to her lips? I think she's admitted to this on several occasions before, but it looks like she had some filler. Other options would be lip implants such as permalip, or lip lift surgery or lower lip advancement surgery. I don't think she had surgery. I think it would have been too obvious with scarring, and I think she wasn't willing to take that risk for her career. So I think that this is just the result of filler over time. You can kind of see the duck lip look that's starting to form in her just from having had that filler over and over. And I think she's had it dissolved several times, but still, over time it accumulates. You get some internal scarring, and that can bring out that fullness of the lip that never really goes down, which again, some people love. But there's also, in some of her photos, a little less naturalness to her lips. But again, I think it's the result of a lot of product that's been placed over time, and her philtrum is made to look a little bit shorter from the impact of the upper lip filler, but it's not a dramatic philtral length change. So I don't think it was surgery. I don't think she has implants. I think it's more likely just lip filler product that has accumulated over time. Those are the changes that I think Kylie has gone through that have really transformed how she looks. I think she looked very pretty before. I think now, with all the makeup and the added structural changes that she's gone through for her overall facial appearance, it's a bit more of a presence, and that really, again, it's setting the tone for a lot of what other people want. So I think it's helpful to kind of talk through what she may have, gone through to get to this final result. And we'll see how she continues to age and what she ends up doing to counter some of those changes that happen naturally.
As the matriarch of the Kardashian-Jenner family, Kris Jenner has always been under the scrutiny of the media and fans alike. Over the years, we've witnessed her evolving style, career successes, and of course changes in her appearance. Today, we'll be addressing the question, has she undergone plastic surgery? In 1973, at the age of 18, Kris starts off with a short top third of her face. She also has some nasal tip bulbosity. She has full cheeks and full upper tooth show with smile. Kris does have strong bony structure to her mid-face and her lower face. In 1982, at the age of 27, nearly 10 years after the last image, you can see that her upper third and her lower third of the face look quite similar. However, to my eye, the nose looks more narrow, both in the bridge and the tip of the nose. These these to me are signs of a potential rhinoplasty that she may have had sometime between the age of 18 and 27. Now when you look at her face, there's less attention to the actual nose, and you can focus more on, say, the eyes. And that is often one of the main goals of a rhinoplasty, to actually take attention away from the nose. In 1990, at the age of 35, I see no change, and that's the same through 1994. In 1995, at the age of 40, there is some increased facial fullness to Kris's face, but I think this is most likely due to a pregnancy around this time. And in 1996, at the age of 41, I see no change, and that's the same through 1999. In 2001, at the age of 46, what I'm seeing now is the introduction of Botox to the forehead, glabella, and crow's feet. Notice how the lines around her eyes are nearly completely gone compared to just 2 years prior. Remember, with Botox or other neurotoxins, these injections need to be repeated every 3 to 4 months to allow sustained effect on the wrinkles. Also, I'm seeing some signs of a potential brow lift with or without an upper blepharoplasty. Kris now has more supratarsal show that we often talk about on this channel. And that is essentially the platform where a lot of makeup is applied to the area over the eye. In 2002, at the age of 47, I see no change, and that's the same through 2005. In 2006, at the age of 51, I'm seeing the introduction of possible cheek filler. There's a fuller connection between the actual cheek complex and the nasal sidewall. But there's still a smooth transition from the upper cheek to the lower cheek. It doesn't look like they're two separate compartments, and you'll see that change later on. In 2007, at the age of 52, I'm seeing the continued use of cheek filler and possibly also under eye filler. And when you look at her nose, it looks like what we call an inverted V configuration. And this has been becoming more prominent over the years, ever since the potential rhinoplasty. And what this configuration is that you can see the distinctiveness of the nasal bone separate from the actual upper lateral cartilages. And this can result from taking down a dorsal hump. This can often be corrected with the use of spreader grafts. These are small pieces of cartilage that are fit in between the septum of the nose, which is the central partition of the nose, and the upper lateral cartilages. These pieces of cartilage help provide more structure to the nose and aesthetically tend to reverse that inverted V configuration. In 2008, at the age of 53, I'm seeing some signs of the start of lip filler. Especially the upper lip is starting to look fuller, and it's starting to look like it has a bit more definition. In 2009, at the age of 54, I see no change. And in 2010, I also see no change. In 2011, at the age of 56, I think Kris may have had a facelift around this time, and she seems to have admitted to it on a reality show. I also saw that this was discussed on an actual plastic surgeon's website, and he claimed that he did the surgery. So it seems like the odds are high that it did happen. Her neckline looks improved, and there's less bunching under the chin. And it looks to me like she also may have had cheek implants around the same time. There's now more separation between the upper and the lower cheeks on both sides. Some people wonder, how can you tell if it's cheek filler versus cheek implants? And I do think that she was getting fuller cheeks from filler initially, but now when you look at the cheeks, there's a lot more form to them, and it's difficult to accomplish this exact type of symmetrical form with filler alone. And you can start to see almost like the imprint of the implant through the skin if you look closely, and you'll see it get more pronounced as time goes on. If you haven't already, please make sure to check out the best skincare and hair care products at feelconfident.com. These are high quality products built from the ground up by me. On the site, sign up for the newsletter to stay up to date on the latest product drops and educational content. In 2012, at the age of 57, I see no change. In 2013, at the age of 58, to me it looks like the teeth have changed a bit. She may have had veneers. There's a color change, and there's also a slight tooth contour change across many of her teeth. In 2014, at the age of 59, it looks like Kris may have started to get some eyebrow thinning around this time. Now, this usually occurs because of age-related changes. It can also occur because of overplucking. The hairs don't always grow back. But remember that there are other causes, other medical causes, such as low thyroid levels or hypothyroidism. Or, for example, what I have, alopecia areata, can thin out the eyebrows as well. Now, remember, in my case, I actually lost my eyebrows completely, but then they started to grow back on their own, and now they're fading out again. That's just the nature of autoimmune conditions. In 2015, at the age of 60, I see no change. In 2016, at the age of 61, it looks like Kris may have started to address her eyebrows with makeup and or microblading. Microblading consists of applying these fine strokes of an ink that is essentially a superficial type of tattoo, akin to scalp micropigmentation that we talk about on this channel. Microblading is just a different type of stroke that's meant to mimic eyebrow hairs. And for some people, an alternative to eyebrow makeup or microblading is what's called an eyebrow hair transplant, and we've definitely talked about that on the channel, and it's something that I do in the practice. It's a great option for men and women who have the right anatomy for it and don't have some underlying medical condition that's going to cause the transplanted hair to eventually fall out as well. And I'm also seeing some additional enhancements to the upper lip. This may indicate persistent use of lip filler. In 2017, at the age of 62, when I look at Kris's nose, it does appear that she may have external nasal valve compromise. You can see that the alar rim of the nose, especially on that left side, is starting to buckle in a bit. It's lost some of its support. Now, this can sometimes be a short-term complication of a rhinoplasty or a long-term complication that you may not see for years until the nasal tissue weakens with just age, and that's compounded by sometimes the removal of cartilage during a rhinoplasty. And as you lose that support and the nasal sidewall starts to buckle, sometimes that can affect the way that we breathe in through the nose. In 2018, at the age of 63, I see no change, and that's the same through 2020. In 2021, at the age of 66, I think that Kris may have undergone a cheek implant revision around this time. There is now more anterior projection of the cheek medially, and there's a more obvious step off beneath the rest of the cheek. Now, the contour of a cheek implant can become more prominent over time as the face ages, and especially as the fat in our face starts to atrophy, or we lose some of that fat. With the decline of the fat in the face, it becomes more obvious if you have this silicone type of implant in your face. It just stands out more. Also, with changing preferences, some people might want to augment a certain part of the cheek relative to a different part, and that type of preference might again change as they mature and age, and just as beauty standards might change as well. But as I talk about often on the channel, it's usually best to enhance the more lateral element of the cheek rather than the medial segment of it. That tends to recreate a more heart-shaped face. In 2022, at the age of 67, I see no change. In 2023, at the age of 68, I'm seeing some signs of a potential facelift revision, and some people have speculated about that on the internet. When you look at her jawline as you go from March 2023 to July of 2023 and all the way out to October, you can see that tightened appearance both to the neck area and to the actual jawline, and that could have been from a facelift revision. And in 2024, you see that nice stable jawline configuration that persists, and I see no other changes. And the total cost of these potential facial plastic surgeries is $420,000. Let's react to Stephanie's video titled WTF Happened to Kendall Jenner's Face.
Kendall Jenner, the most natural, humble member of the Kardashian Jenner clan. Kendall Jenner is...
It does seem that way, I agree.
So there I was, minding my own business, trolling through Google, researching for another video when a picture of Kendall Jenner that was recently taken popped up. And I couldn't believe my eyes. Being a part of the Kardashian Jenner family, I would say that the pressure on Kendall is huge.
Oh my god, I get to go with Kendall Jenner to the Vanity Fair party.
This family is all about looking perfect and altering your face and body to fit the current trend and monetizing your appearance.
I'm kind of ready for our culture and our society to just move on from this family, to be honest with you, but let's see how long it'll take to get there.
I never thought that Kendall, out of all of them, would go this far. So this was Kendall naturally as a teen, and this was Kendall post glow up. What the happened to Kendall's face? So in our last video where we discussed the potential tweakments that the most natural Kardashian Jenner sister has had, we decided that she likely has had her nose refined, aka a surgical nose job, because as you guys can see, the nose Kendall has now is vastly slimmer.
Yeah, I definitely agree here that the nose looks more narrow to me, both in the bridge and in the nasal tip. And look at the eyebrow positioning. It looks so different from this sort of before to the after. It has that lateral sweep, that sort of Bella Hadid appearance.
I think it's quite obvious that she's also likely had a brow lift to lift her brows. I mean, she used to have quite a heavy brow. As you guys can see in original Kendall photos, her brows sat pretty low over her eyes, giving her eyes a more hooded look. However, a few short years later, in her early 20s, this heavy brow and heavy lidded look was totally gone, and her brows now point up at the outer corners, and her hooded lids are now also open and totally spacious. Again, losing weight in the face and body can have this effect naturally.
Yeah, I mean, look at that cheek prominence. It just doesn't look natural to me.
Naturally, but again, with Kendall, she didn't lose weight. She was
And the lips. Ooh.
She always had a pretty pouty bottom lip, but her top lip, especially when she smiled, curled up and under. And that, unfortunately, does not fit the beauty standard today. And as we know, Kardashian Jenners must always fit the beauty standard despite what they may look like naturally. So, to achieve a...
Well, in a way, they create the beauty standard, which is interesting. So they're sort of fitting the standard that they're setting, which is like very odd, but I think it's true to a degree.
Bigger top lip, you can have a lip lift where a surgeon will put a cut between your nose and your lip and literally pull your lip up, then sew you back up.
I don't know. She's never had a long distance there. You know, I know she's been getting a lot of filler. The other thing I look for is the exposure of like the teeth when you smile. So when you look here, she had almost full dental exposure up to the gum line when she smiled. A lip lift would have brought that out even more, would have exposed almost to the gum line itself. Whereas in the more recent picture, it looks like she has some covering over that. So it's possible that she just went down the filler route as opposed to the lip lift, but I appreciate Stephanie's idea here.
Or you can get lip filler. At the time, I thought that Kendall had most likely had lip fillers, but now I think she's done more. So here is post glow up Kendall in 2020, and here is current Kendall barely 2 years later. In my humble, non-expert opinion.
Oh yeah, look how short it's looking. But also, it looks like she's using some of the lipstick and the makeup to cover over. You can see where her natural lip line is. You can actually see the light reflecting over the natural vermilion border where the white roll is. And then you can see the makeup above that. So I think it's giving the illusion of a shorter philtrum than what she actually has.
If you compare these two photos of Kendall's natural top lip to the size of Kendall's top lip now, and yes, I know she's wearing a lot of lip liner in this current picture, but you can clearly see where her actual lip ends and the liner keeps going. Her top lip now is simply just much bigger in size. I really think that she may have undergone another nose job in order to lift the tip of her nose. So like the bridge of her nose doesn't really look any different, but the tip, especially from side on, looks very similar to her sister Khloe's nose.
Yeah, I mean, you can even see that the nostril exposure here from lateral view is just different. And it could be the way that the head is positioned compared to this other image. But, you know, I can believe it, you know, that maybe there's been a shortening of the nose and a slight more rotation to the nose as well.
As we now know, Khloe has also recently undergone a nose job. And when you compare the two of them originally compared to the two of them now, The noses never looked alike before, and now they do. Then we have Kendall's face shape, most notably her cheeks. This is what I think has made the biggest difference to the way that Kendall's face currently looks. To me, it looks...
And I even mentioned cheek implants at the start of this talk as I started to see some of these images popping up, but I'm guessing that's where she's going with this.
As though Kendall has gone to town on cheek filler, or even more dramatically, potentially had cheek implants,
Boom.
which is actually not that unusual in Kendall's world. I can see why she would do it, to be honest, because she's 26, and in her world, approaching 30 is considered aging, and in Kendall's world of aesthetics and beauty and maintaining your youth for as long as humanly possible, a fuller face, in particular high full cheekbones.
Yeah, that's not looking natural, and also filler gives a slightly different look. It's not as balanced throughout the entire cheek from medial to lateral compared to a cheek implant, which has that sort of perfect shape.
Gives the illusion of a youthful look, so I could see why Kendall may opt to have had that done. Not to mention the fact that Kendall is very tall and slim naturally and obviously maintains it for her job as a model, and that's fine. However, being that thin can make your face look a little gaunt, which is not a look that the Kardashian-Jenner tribe subscribes to. So it would make sense that at this point in her life and career, Kendall might have made the decision to get her cheeks filled. And it's not that it looks bad, I actually think she looks lovely, but I thought she always looked lovely. And it has really changed the way her whole face looks. And in my opinion, instead of making her look more...
Yeah, it seems like all these different changes that the Kardashians are going through, yeah, of course they're aging, and some of the changes are meant to combat aging, but it looks like they're constantly changing their look and trying to reinvent themselves and almost stay relevant.
Youthful, which is kind of the goal of cheek filler. I dare say that the what seems to be a large amount of filler in her cheeks has actually made her look older than 26 because the heaviness in her cheeks...
I do think that all the surgery that these young women are getting in Hollywood is aging them faster, and I do wonder what impact that's going to have on their appearance when they're like, let's say 50, 60 years old. Keep in mind, you know, this is something very new. Like, we haven't seen the results of patients getting this much surgery this young and how that's going to transform their looks later on in life.
Is having the knock-on effect of dragging down her lower eyelids. Finally, in my humble opinion, and feel free to totally disagree with me, guys, let me know what you think in the comments, I think that Kendall may have just gone overboard on Botox, which is not a big deal. Botox is not permanent, it only really lasts a few months, but I do...
Botox itself is not necessarily permanent, but Botox effects can be to a degree permanent, meaning that if you're getting it time and time again, every, say, 3 months, religiously for many, many, many years, it can atrophy the muscle, and that can have some ramifications, such as, for example, if you atrophy the frontalis muscle, the brows can appear heavier, right? So then you have to combat that with additional brow lifting. Same thing with fillers, as we know that filler doesn't completely go away, and it does linger around and migrate over years.
It seems to me that she has had Botox injected into her outer brow and eye area, which is supposed to lift the outer brow, and I know because I did it. It didn't work for me, but then again,
The lifted appearance that Kendall has most likely is from the surgical procedures as opposed to the actual effects of Botox.
I've got totally different bone structure to Kendall. But in Kendall's case currently, I feel like the Botox may have just been a little bit overboard because I think it's accidentally made her look a little bit angry. Like when you look at paparazzi pictures now of Kendall where she's just minding her own business, walking down the street, she looks a little bit annoyed. Personally, I feel a little bit sad for Kendall because I feel like being a sister in one of the most famous families in the world, a family that is so image obsessed and so obsessed with looking perfect and maintaining this beauty standard, I feel like it's finally getting to her. Anyway, that's my 2 cents. Let me know in the comments what you guys think. I love your guts, and I'll see you in my next video.
I really enjoyed this commentary by Stephanie, and hopefully you guys enjoyed the reaction video. Please make sure to subscribe to Stephanie's channel and to our channel. Thanks. So our last video where we reacted to Stephanie's video on Kendall Jenner did well, so we decided to do another one. This one's about Kim Kardashian. Let's go.
Kim Kardashian's crazy transformation. She is generally regarded as one of the world's most beautiful women, and let's be real, she is. She has always been stunning. However, despite that, she has also had a very dramatic yet subtle transformation over the years. And it's basically been swept under the carpet, and no one, including Kim herself, really seems to acknowledge it. Now, Kim's influence can't always be said to be positive, and that's okay. I feel like this is where we go wrong when we put other human beings on pedestals as being so much more important and beautiful and influential than anybody else, and we expect them to be perfect, and then when they're not perfect and they inevitably fuck up, everyone is shocked by it. In saying that, it is important to acknowledge the effect that Kim has had on humankind everywhere since she burst onto the scene back in like 2007. There are women who literally spend their entire life savings to look like Kim Kardashian.
Yeah, I heard there was one person who spent like $500,000 and then another $150,000 to detransition is the terminology that was used, which I don't know, that's really out there. But yeah, people are spending money to look specifically like Kim. So my message to people in general who are interested in plastic surgery to improve certain features about themselves is always just become potentially an optimized version of yourself. Don't try to be somebody else. That never works out.
Truly believe that she is perfection personified. Like, look at the case of Sherry Lee, who has spent over $60,000 to change her naturally gorgeous self to look more like Kim. Sherry herself says, Kim has always been an inspiration to me, and she is the most beautiful woman in the world in my eyes. Sherry has since gone on to have 3 BBLs, 2 boob jobs, and several facial reconstruction surgeries, all to look more like Kim Kardashian.
Yeah, that's kind of sad. And, you know, I always ask my patients like what their goals are and why they're looking to get a certain procedure done. I think it's important for surgeons to inquire about that because obviously mental health and plastic surgery are intertwined in many ways. Most patients who get plastic surgery, at least who come to my practice, are very stable mentally. They're very normal people who just want something enhanced. They want a slightly better version of themselves, or they want to look like they used to look 5-10 years ago. But for the folks who are looking for a complete transformation into someone who doesn't even nearly resemble what they looked like originally is not healthy, and that ought to be stopped at the level of the surgeon, you know, who plans on doing the procedure. So it's okay for a person or a patient to have thoughts like this, but I think it's up to the medical and surgical community to put a stop on that type of behavior and say, we're not going to condone that. We won't operate, you know, if your goal is to look like someone who's completely different looking than yourself, because the intensity of the surgeries that it takes to get someone there is immense, and it can't be easily undone. Most of it can't be undone at all. So it's something important to keep in mind as a society, I think.
Even argue that the effect that Kim has had on her own younger sisters has been somewhat detrimental. When you look at the very dramatic physical transformations that they have had at such young ages, and in a strange way, it's almost as though Kendall and Kylie in particular are trying to alter their looks to look more like Kim. Could it simply be sisterly love? Or have Kim's little sisters felt the pressure of being in such an aesthetically obsessed family?
Yeah, I don't think it's sisterly love in this case. I think it's the latter. Yeah, I mean, it's this whole desire to look like somebody else and to do surgeries at a much younger age than what we used to see before the Kardashians came onto the scene. It is a bit alarming, I think. And it's the trend that will, unfortunately, I think, continue. At some point, it's just not wise to start too early.
And as such, felt the need to change their looks to better resemble their beautiful and successful older sister, without whom them themselves would likely never have even achieved fame and fortune to begin with. So Kimberly Noel Kardashian was born in 1980, making her 42 years of age now. On the surface, looking at Kim, it wouldn't appear as though she's had much done in the way of surgery or tweakments. She doesn't necessarily look overdone or overfilled or botched, but as you guys can see at a quick glance, she absolutely has changed a lot since she became famous.
We have a video on Kim Kardashian's facial transformations. Make sure to check that out, as well as a recent video on Kim Kardashian's hair procedures. So make sure to watch that video as well.
And yes, a lot of that would have to do with aging. I mean, she was 27 when she became famous, and now she's 42. So that is a long time, and your face is inevitably going to change a lot in those years. But is your nose going to shrink? Are your lips going to get bigger? Are your cheeks going to get fuller? No, actually. In fact, quite the opposite usually happens. Fun fact, your nose and ears actually never stop growing your whole life. So what has Kim done to, number 1, halt the aging process, and number 2, stealthily alter her appearance in such a way that she is now generally regarded as like the epitome of the beauty standard, and no one really noticed? I personally think that Kim has changed just about every aspect of her appearance. But we'll start with her nose. I do think that Kim's nose has been tweaked in a very dramatic but sneaky way so so that on the surface,
Sneaky.
it looks like she hasn't touched it. That is just the nose she was born with. But when you look into it deeper and you compare...
Well, keep in mind that good plastic surgery should whisper, it shouldn't scream. So it's very normal to have plastic surgery that's done well for it to then not be noticed by most people. If the surgery is very much obvious and everyone can pinpoint exactly what changed, then it probably wasn't the best quality surgery in the first place.
Original Kim to current Kim, you'll see that her nose is actually very different. If you look at these pictures of original Kim before she achieved worldwide fame, you'll see that her nose was quite a distinctive shape. From side on, you can see that her nose sloped out and downwards, which is what mine does too, with a distinguishing hump on the bridge. According to an article I found, these beautiful people are Kim Kardashian's Armenian ancestors, and I quite believe it. The family resemblance is really strong, and I think it's such a sacred and magical thing to have such a strong physical tie with your ancestors. As you guys can see, the resemblance between Kim's ancestors and her dad Robert Kardashian is super strong, and that absolutely has filtered down to Kim, as she in turn very much resembles her father. It's not shocking, it's kind of how genetics work, but I personally love it and I find it so interesting. It makes it a lot easier to block out the unrealistic beauty standards and appreciate your own unique characteristics when you can actually see why you have them and where they came from. Like, look at the crazy resemblance between this ancestor and Kourtney, for example, and this young man and young Kim. I love this stuff. Kim's original nose was very similar to the nose of her Armenian ancestors, but her current nose, not so much. So what happened? Well, Kim's genetics haven't changed, so my guess would be that she underwent a surgical nose job to change the slope of her nose, refine her nostrils, and give her nose a more upturned tip. However, an interesting thing to note is that to an extent, she chose to keep the hump on the bridge of her nose. Why would she do this? Why bother going to the pain, effort, and expense of a nose job if you're going to leave the hump on the bridge of your nose anyway? Well, it's actually quite common in Hollywood for famous celebrities to refine their noses, but leave a small imperfection to make it seem as though they are au naturel.
Yeah, we saw this with Hailey Bieber. And we also saw this more recently with Gwen Stefani in doing a reaction to her facial transformations.
Hailey Bieber is rumored to have done this, as her nose does appear to have been refined, and yet it still tilts to the right. Blake Lively slimmed down her nose and yet kept the original shape, just made it smaller.
Also, something to keep in mind is that it's very difficult to completely alter someone's nose into someone, like to make it look like someone else's nose. I mean, you'll still have some of that core structure. You can just kind of modify it to a degree, but you can't really convert it into a totally different nose unless you take away so much tissue and cartilage that you actually collapse the nose. And we've seen that, of course, with Michael Jackson and other celebrities too, and other people. So you don't want to completely alter the nose, too much. But of course, when it comes to the hump, that's a very personal decision whether or not to take that down or leave it where it is. But these types of smaller tweaks to the nose is actually very normal. And some patients who come to me asking for more radical changes to their nose, I explain to them that given the thickness of their skin and the overall appearance of their nose relative to the rest of their face, it wouldn't make sense to do anything too major as far as modifications go.
Kim's own sister, Kendall Jenner, who also seems to have had her nose refined, but still kept the original slope to her nose so as not to make it look obvious, like her sister Khloe, for example, who has had a nose job and totally went to town. Or Bella Hadid, who changed her entire appearance when she changed her nose. Kim has kept her alleged nose job subtle in comparison, and it's worked, as most people still don't think that she's had one. But I personally think when you compare pictures like this of...
You can also see in the size of the nostrils and the nostril opening how it's been changed with the modifications, with this like deep projection of the nose and this increased rotation of the nose. The opening just looks different, and that's not something that just happens on its own.
Original Kim and this of current Kim, it's pretty darn obvious. Of course, Kim denies having had a nose job. Then there is Kim's changing lip shape. Now let's be clear, Kim has always had full lips. And full lips are the current Western beauty standard, so that works well in Kim's favor. You would think then that there would be no need for Kim to change her lips, right? Wrong! As you can see in these older pictures compared to these pictures, it appears that Kim absolutely has changed her lips, but again, in a very subtle way. But it hasn't always been subtle. Just like with most others who get lip filler, sometimes it's easy to get a little bit over-enthusiastic and get just a little bit too much put in, and bam, you have the dreaded duck pout. As you guys can see from the side, Kim has at times been a duck too. And Kylie. It happens. It's not permanent. It's not the end of the world.
And we talked about with Kim in the past how it was likely the result of a lip lift that allowed her to remove that ducky appearance of filler that was making her lips more protruded and reestablish the kind of flatter to the face type of form to the lips and to reduce that philtral distance, especially because of the rhinoplasty. Anytime someone gets a rhinoplasty, they're at a pretty high risk of having a longer philtrum because of the fact that they had the rhinoplasty. So then to counteract that, it seems like Kim went the lip lift route, shortened this distance, the lip flipped out, this distance shortened, it was still flatter to her face, and the lips also look fuller because of that. And what I talk about in some of my lip lift videos, which is I think an interesting phenomenon, is as the upper lip gets larger and it gets closer to your nose, the bottom lip usually tends to increase in size as well to help it meet that upper lip. So it tends to give the impression of a larger lower lip as well.
It does go down, it's okay, but it's annoying. And it makes it very, very obvious that you've had lip filler. And if you, like him, are trying to make out like you've never had filler or never had any tweakments, it can be really annoying because it makes it really obvious that you have. Another aspect of Kim's facial appearance that I think has made a huge difference to the way that she looked before versus how she looks now is that she has changed her smile. What a random thing to do considering her natural smile was so bloody beautiful. And now her smile is just very generic Hollywood. It's like she slowly over the years began erasing her individuality and quirks. In her older pictures, her smile was very similar to that of her sister Courtney and her dad Robert, but now, I mean, it's still beautiful, let's be honest, but it's just different. She may have changed her smile by getting lip filler, but I think it's more likely that she's underwent a lip lift and Botox in her philtrum to drop her top lip. Now, what the does that actually mean? Well, a lip lift is when a surgeon...
Oh, she's going into lip lift discussions. Great. Let's see if she's used our video like she did last time in that other video.
Will go in and cut a portion of the skin between your lip and your nose, pull your top lip up, and then sew you back together. It means that your top lip will look fuller and poutier.
I don't think those are my before and afters.
Naturally, without the telltale lip filler look. Now, Botox in the philtrum is actually a...
Also, just keep in mind here, in this image that I'm looking at here at 7:31, yes, I agree with what Stephanie's saying so far, but with the arrow pointing to the lateral aspect of the upper lip, it's important to mention here that with a lip lift, it's usually the central 2/3 that are being lifted. The lateral elements usually stay in and inverted if that's the way that they start. It's just that there's not that much impact on the lateral lip when it comes to a lip lift. So in order to address the lateral elements, you would need a corner lip lift, and that is something that can be done at the same time as the regular bullhorn style lip lift, or can be done in a more delayed fashion. I personally like to do it in a more staggered way, to do the lip lift first and then see if the person still could benefit from a corner lip lift, and also because that gives me the opportunity to monitor how they heal. If the healing isn't optimal, then I wouldn't want to give them a scar right at the vermilion border for a corner lip lift.
Naturally, without the telltale lip filler look. Now, Botox in the philtrum is actually a super common procedure. It takes like 2 minutes to do. It's not difficult. And that's where an injector will put a bit of Botox between your top lip and your nose, which will relax the muscle there. And as such, when you smile, your top lip won't be pulled up so high. Like for example, Kim's old smile, where you could see her whole row of top teeth. Now when she smiles, her top lip sits lower and covers the top of her teeth.
Keep in mind also, it may have been from the rhinoplasty. As I mentioned earlier, when you do a rhinoplasty, you're disrupting some of the orbicularis muscle as you manipulate the tip of the nose. And that could also drop the philtrum and make it so that you're not smiling as fully as you used to before. So maybe it's the Botox, but my guess is there's no reason for why Kim would have gotten Botox of the type that Stephanie's describing. Maybe she had some Botox right at the vermilion border to give her a little bit more of a flip out of her lip. But getting Botox into the depressor septi muscle or along the base of the nose in the upper philtrum to drop the upper lip, I'm not sure what the purpose of that would have been for her. I think that would have been disadvantageous, and the whole purpose of getting the lip lift for Kim was to reduce that distance. So she would be countering that with the Botox injection. So I don't think she was getting that.
A lot of people do this procedure if they feel like their smile is too gummy, so perhaps Kim felt the same. I do think that for a while she went too far with the Botox and the relaxing of the top lip, because the gap between her nose and top lip just kept getting bigger and bigger, and she honestly stopped looking like herself for a while. Kim's smile.
Also, I should mention here that the philtrum lengthens with time. So Kim is not, 20 years old anymore. So that distance would have been increasing with age anyway. So those, I think, are the more common reasons and also the most likely reasons for why Kim's philtrum got longer. Both aging process and the fact that she had a rhinoplasty as opposed to these Botox injections of the type that Stephanie's describing.
Also used to pull down at the corners of her mouth, the same as her sister Courtney and her dad and her granddad. And it was...
Because look, even at this picture of her at age 11, she's still not showing gum at her full smile. So it's not like she overly had like too much gum show with smiling. So again, another reason why I just don't think that she had those types of Botox injections.
Lovely. Now it doesn't. I'm not entirely sure how this change occurred, but I would suspect potentially Botox in the corners of her mouth to stop the muscles pulling down when she smiles. I don't know if any of you guys have any theories as to how one achieves this. I am intrigued. Let me know in the comments.
So what I'll say here is that to me, when Kim was younger, it doesn't seem like she had that sort of pull down of her smile that Stephanie's describing. We'll flash some other images of patients who do have that type of phenomenon that can occur. For those types of patients, injections of Botox into the DAO muscles, the depressor anguli oris, those are the types of injections that can relax the muscle that pulls down the corner of the lip and allow it to be in a flatter, sort of more stabilized position higher up. Now, that is the type of injection that's done when you really have that kind of downward pull, but I don't see that in Kim's appearance when she was younger and smiling.
Then we have Kim's cheeks. Not her butt cheeks, but these things. Kim, the cheeky sod, even goes as far as to deny having filler. Excuse me, what do you take us for? It's quite clear to me that she has totally dabbled with her fair share of filler, and that's okay. Getting tweaked.
And we talk about cheek implants for Kim in our video, but also most likely she at least dabbled in filler as well. I do agree with Stephanie on that.
Getting filler, heck, getting cosmetic surgery, it's not a crime. We are all free to do whatever the heck we want with our faces, and it's not something to be embarrassed about or ashamed of. To me anyway, it seems that Kim has definitely had her cheeks filled. Whether it be with filler or implants, which in fact would mean that technically she's telling the truth when she denies cheek filler, her cheeks have definitely been plumped. Looking at pictures of original Kim to current Kim, her cheeks were always lovely and full, but now they have that telltale high, stretched, full look. Then there is Botox. Now Kim claims that she is in fact allergic to Botox and that whilst she has dabbled with Botox in the past, she now has chilled on it. I call bullshit. You can literally see the telltale signs of someone who has utilized the muscle relaxing and tightening.
Now, some people over time become more tolerant of Botox in particular, so they might need to switch to a different neurotoxin so that, they can get the same effect they used to get with Botox. So that's possible. Something like Dysport is maybe what she's using now, but regardless, she's most likely using some form of neurotoxin to give her that smoother appearance, especially to her forehead, glabella, crow's feet area.
Effect of a lot of Botox. When Kim tries to cry, she literally struggles to frown and scrunch up her eyes as her muscles have been paralyzed and she can't do it. Sometimes she'll have one eye squinting.
Many actors have moved away from using neurotoxin because they can't deliver those facial expressions that we expect of them when they're acting.
And the other not, which can happen from Botox too. But sometimes one brow appears a little bit higher than the other and it's as though she can't level them, which happens to be another side effect of Botox. Her mum Kris often has the same side effects, which is normal to be honest. Botox is great, it's effective and it's minimally invasive, but it isn't without side effects.
And now there are different types of neurotoxins that are purported to be lasting much longer, like closer to 6 months. But imagine if you cause a lot of asymmetry with the brows, now the person has to wait 6 months before that will self-correct as opposed to the 3 months that Botox usually lasts. So that's one of the disadvantages to these neuromodulators that are lasting much longer.
There's also rumors that Kim has undergone a facelift, which
Yes.
I don't know if I agree with. I think it's highly possible, knowing how obsessed Kim is with her looks and keeping...
Yes, it looks like it's more than highly possible. And again, we discussed that in our video.
Keeping a youthful appearance, and there are accounts online who are adamant that you can see telltale scars that prove she's had a facelift, But I mean, 42 is not old. It's not surprising to me that Kim looks young, because in the grand scheme of things, she is. This is not a woman in her 80s that we're talking about. So I don't know about that one. I think it's highly possible and probably quite likely, but I'll reserve judgment on it because I don't think it's quite as obvious as her other tweakments and surgeries. Now you have to ask yourself, why would someone who was as naturally gorgeous, like naturally stunning as Kim Kardashian go to such efforts and expense and pain to alter her looks to this extent? Was she, like Bella Hadid, subconsciously trying to erase her ethnicity? I think that she probably thinks that her worth is based on her looks, and that if she were to begin to show the signs of aging or to lose her good looks in any way, that she would no longer be considered successful or beautiful, and she just frankly wouldn't be able to handle that because being beautiful and...
I think Kim recently said that she would just do anything that needed to be done to look more youthful. And so that, I think what Stephanie is saying here makes sense.
Being successful is basically all she's ever known. And if she thinks that her worth as a person is based on her looks, then aging or gaining weight or not fitting the current beauty standard would simply be unacceptable to her. But the thing is, Kim is so much more than her looks. Like, she is a successful businesswoman. She is a mother.
But we do have studies out of Hopkins for facelift results, rhinoplasty, and hair transplant that all show that there is an impact on success for people who get these procedures done. And so it's not just how you feel internally. It's not just this perception that maybe people will think of you as, more successful or less successful if you do or do not get plastic surgery. There really is a direct correlation between people who get these procedures that are, of course, done well and the way other people perceive them. And that's been documented in the studies out of Hopkins. So yeah, there's a lot that's involved with plastic surgery, especially changing one's face and one's identity. And I think it's a complicated matter, and maybe Kim has reasons beyond what Stephanie has brought up for having these alterations done to her face and to her body, of course, as well.
She is a mother. She is someone's daughter. She is a sister. Her looks aren't her. They are surface level. And I just hope that she knows. And I hope that she knows that she is so much more than her looks, because that would be such a superficial, downright depressing way to live.
Yeah, Kim seems like a really intelligent woman, and I'm sure she knows all that as well. But, to maintain the top standing that she has in society, I think she probably feels the pressures to do these different procedures to stay looking the best that she can possibly look, and setting the standards for many other people. Has Kim Kardashian had hair transplant surgery? In 2006, at the age of 26, let's look at Kim's hairline position. We've standardized the photo to corneal length to measure the horizontal thirds of the face. The upper, middle, and lower thirds of her face actually appear very close to one another at 6 centimeters. I'd like to mention here that the standard hairline height in women is about 5 to 7 centimeters. So of course Kim is perfect. What else is new? In terms of the ideal position of the hairline, there's different ways to look at it. One is the actual measurement that we just talked about. Another is looking at the vertical forehead and the horizontal of the top of the scalp and seeing where those two meet. As far as the shape of the hairline, it looks like Kim has an M-shaped hairline. There are other hair types as well. And you'll see as this video goes on, she's sort of starting to morph into other hairline types. As far as the hairline quality, there are fine hairs at the front that are fading into thicker hairs, which is very natural. She has good hairline density as well, and her hairline is regularly irregular, which gives it a very natural appearance. As far as her part line, it's to the left of center, which it's usually not in the midline. Of course, you can always style your hair with a part down the middle, but in women, generally that part line is off-center. In 2007, at age 27, she assumes here her more natural part on the left, and that's what I was talking about previously. In 2008, 2009, I don't see any changes. In 2010, at the age of 30, I think she may have had her first hair transplant around this time. She does admit that the baby fine hairs at the front by the hairline were lasered away, and I see that, and I definitely agree that that is what happened. However, there is increased regularity at the hairline. the frontotemporal corners appear more closed, and the temple density to me has increased. The hairline shape is now more rectangular. So she likely had an FUT procedure, which, as you guys know, is when we take out a strip of the back of the scalp as opposed to the 1x1, because in 2010 FUE wasn't really popular. And so likelihood is, with her long hair and with FUE usually needing to shave, she probably opted for the FUT, which is not very noticeable with her longer hair. Maybe about 800 to 1200 grafts. The hairs at the hairline appear less fine in quality, as they now resemble more of the occipital scalp hairs. In some ways, they adjust the new location, which is the recipient area. In some ways, they can also hold on to qualities from where they arrived. So I think that concept is very important to keep in mind. In 2012, at the age of 32, I wanted to point out here that there's nice subtle change from the original. So it's not enough for most people to really notice anything happened. And I think that is her overall MO when it comes to plastic surgery. The other important point here is that there is something to be said for iterative change, right? Not just for Kim Kardashian, but for anyone considering cosmetic procedures, whether it's injections of like filler, Botox, or if it's something surgical, such as hair transplants. There's nothing wrong with going with smaller changes over time as opposed to one big surgery that really creates such a major change that everyone notices that, hey, this person had something done. Oftentimes I find patients don't really want to go through multiple procedures over time. They just say like, I just want to get it done. It's a better approach in many cases to take more iterative steps towards improvement. In 2013, I see no changes. In 2014, also no obvious change. In 2015, at the age of 35, I think Kim may have had her second hair transplant. You can see a procedure here of maybe another 600 to 1,000 grafts, likely another FUT procedure. I'm seeing increased density at the hairline. I'm also seeing that the hairline looks more rounded. So now she went from M-shaped to rectangular to more rounded over time. The left side of her frontotemporal area used to be her more recessed side, but now it appears overcorrected. So her right side is now her slightly more recessed corner. From 2017 to 2020, I'm not seeing any further changes. However, in 2021, at age 41, it looks like Kim may have had yet another hair transplant. So at this point, I'm not seeing any frontotemporal recession at the corners. She has a very rounded hairline, and I'm guessing at this point it may have been another maybe 600 grafts to just touch up the area. And keep in mind that at this point in 2021, she may have had an FUE procedure because the technique is of course a lot more advanced than it used to be. And it may have been done for that number of grafts, 600 grafts. You know, I would have offered her no trim, no shave, so that you don't see that anything was done in the back, yet you get the grafts that you need to create the change that you want to create at the hairline. And in 2022, I see no further changes. But you can really see the shape difference compared to even 2 years prior. The total cost of all these possible hair transplants is $75,000.